Hormones are essential to good health. There was a study that came out in 2002 that talked about the evils of hormones. That was 16 years ago. In the subsequent 16 years, we have had many studies coming out talking about the tremendous value of hormones. So if somebody tries to tell you you shouldn't take them, they're simply 15, 16 years behind the times, and they don't know the recent data, the recent studies, and that's too bad that that's allowed to continue. Hormones are fantastic for bone. In fact, our patients are realizing increasing density of bones rather than decreasing, and that's because we're treating with estrogen, testosterone, vitamin D3, and weight-bearing exercise. Those four things are fantastic for bone, and they work really well for most people. Hormones for women have all kinds of benefit. They decrease heart disease 50%, which is enormous. They inhibit Alzheimer's and dementia to the tune of about 50%. They stop bone loss. In fact, we have bone gain. Decreases colon cancer 35%, maintains moisture and elasticity in vagina and bladder so that bladder function and intercourse works better. It thickens the skin so that you have fewer wrinkles. So for vanity's sake, it's good for that as well. And, it gets rid of menopausal symptoms, it enhances energy, it helps you sleep. It does all kinds of wonderful things. So hormones are tremendous for women. By age 50, 55, men have about half the testosterone they had when they were 20 to 25. So it's a gradual, slow onset of problems for men. And some guys will go to their primary care provider and get their testosterone checked. The problem is the primary care provider is looking at a lab sheet that tells him, normal is 300 to 1,000. Well, that is not normal. That's the average guy at that age who is sick. If we want optimal levels, we're shooting for 800, 900, 1,000, and that's what really makes the difference for men.